Hello and welcome everyone. Today we will discuss on frailty in ICU. Frailty has become a condition we as intensivists have been gradually more familiar with. An early paper about frailty in the ICU context was published in 2014, and since then it has attained considerable attraction. Nearly 50% of the patient admitted to ICU belong to age greater than 60 years. Frailty is important because it not only affects mortality outcomes but has been found to prolong ICU and hospital stay with increased use of organ support as well as a poor quality of life post-hospital discharge. Frailty may be measured or estimated using many methods, and the gold standard is the comprehensive geriatric assessment. This takes time and requires a fully co-operable patient and is not possible to use at ICU admission. So, how do we measure frailty in ICU? The first method is Fried's phenotype of frailty. Here you assess the 5-point and based on its score. It's quite simple and can be used. Next method is frailty index. Here you look for these diagnosis and give points. Finally you give a score to frailty. It's quite extensive and requires proper history. The next method is more sophisticated. Here you look at the retrospective diagnosis based on ICD-10. Then use the algorithm to get a score. This is hospital risk of frailty. It's time-consuming and can be used when you have adequate resources for this. The system that we use for assessment in our ICU is Clinical Frailty Scale. Here you grade from 1 to 9. Here are the 4 set of questions that are asked to the family. Based on the answer we can grade the frailty. If it's more than 5, consider the patient as frail. So to summarize, once a patient is admitted, look if the patient looks frail based on the age or chronic illness. If patient seems frail, then apart from the physiological scores like Apache 2, also calculate the frailty score. It is important to be consistent in the use of frailty assessment method to familiarize the ICU to the same tool, and do comparisons over time. The tool should have been validated and proven valuable in controlled studies, should be easy to use and easy to understand and learn by the ICU staff. It is important that the reference time is the level of frailty prior to the acute illness leading to a hospital or ICU admission, usually 2 weeks prior to the admission. Together with other parameters, it can be helpful in admission decision as well as in end-of-life discussions later in the ICU. So always measure frailty. Then use it for prognostication and clinical decision. Thank you.